Moving on to the muscles that we find in the cervicothoracic region. To give you a brief summary of them all, it's the most complex region that we have in the body, and the muscles can be divided up into deep, intermediate and superficial layers. The deep layers, or the deep muscles, are usually fairly small, and their primary function is to support the head on the neck rather than producing any significant movement. These are predominantly stabilizing muscles. The muscles in the cervical region, especially the deep muscles, are very richly innervated, especially with proprioceptors. Muscles may have a role in moving the head on the neck. Those muscles will always have a cranial attachment and then an attachment onto the upper cervical spine, moving the head and neck, so they will have an attachment onto the cranium down to the lower cervical spine or upper thoracic spine, or even onto the shoulder girdle, and those ones that move the neck alone, and they have no cranial attachment. Starting off with the superficial layer includes the two trapezius muscles, levator scapulae, and the rhomboid. So here we have you can clearly see here one of the trapezius muscles over here. The other one's been dissected away, and underneath that we can see the muscle of levator scapulae here coming obliquely down towards the upper medial border of the scapula itself. Okay, these are the rhomboids down here. We can see these short, thick, stout muscles that have been cut. They are rhomboid major and rhomboid minor. The function of these muscles is obviously to produce shoulder girdle movements as well as movement of the cervical spine, and they may also assist in deep inspiration. When we look at the intermediate layer is made up predominantly of the erectus spinae muscle. Now, the erectus spinae muscle has got three pillars. The iliocostalis, which is the most lateral of our three pillars. Then we have longissimus, which is the intermediate pillar. And then the most medial pillar and the smallest is spinalis. And here we can see spinalis. And erectus spinae is a very complex muscle. It'll be covered in more detail when we look at the lumbar spine, the muscles of the lumbar spine in particular. But it's a very complex muscle that we divide up into the cervical sections of erectus spinae, the thoracic sections, and the lumbar section. When we look at the deep muscles include muscles like semispinalis, which we can see here. Here is semispinalis capitis, for example, which this is actually one of the deep stabilizing muscles of the posterior cervical spine. There are some small muscles called intertransversarii and rotatories interspinalis, and then there are some small muscles that attach the ribs to the transverse processes. These ones here called levatories costora. As said earlier, the primary function of these muscles is for stability and for proprioceptive feedback in particular. The muscles which produce flexion of the neck, here we've got muscles such as on the anterior aspect here we've got longus colli that passes from the anterior aspects of the vertebral bodies of C1 all the way down to T3. These are long fibers that pass all the way down. So there's longus colli coming down here on the medial column. We then have the scalene. So here is scalenus anterior, which passes from the transverse processes of C3 to C6 all the way down to the first rib. These are lateral flexors of the neck, but they also play a role in cervical rotation. But because of their attachment onto the ribs, they're important accessory inspiratory muscles. And then we have muscles like here, the huge sternocleidomastoid that goes from the body of the sternum for the sternal head and the medial third of the clavicle for the clavicular head. The two heads converge together and come up and attach onto the mastoid process just behind the ear. These are large muscles offset away from the axis of rotation, so these are big explosive muscles that play an important role in dynamic movements. They are not good stabilizing muscles, and overactivity or tightness of sternocleidomastoid can lead to very abnormal cervical postures. When both sternocleidomastoids work together, they produce flexion of the cervical spine, and that's assisted by this muscle here, longus capitis. So we can see here, this is the anterior aspect of the spine here, that's the anterior aspect of the spine coming down here, and there is longus capitis passing down here from the transverse processes of C3 up to about C6, passing up and attaching onto the base of the occiput itself. And again, when both of these muscles contract, they will both produce flexion of the cervical spine. Up here, we have tiny muscles called rectus capitis anterior, again passing from occiput down to the lateral masses of C1. Going around the back, we've got muscles that extend the cervical spine. So we've got muscles like the levator scapula, as was mentioned earlier, and then here we can see splenius cervicis that passes from the spinous process of T3 to T6, passes upwards and laterally and attaches onto the tubercles of the transverse process on the upper 3 cervical vertebrae themselves. This big muscle that we can see here is splenius capitis. It lies deep so it's covered here, and the top part is covered by a sternocleidomastoid, and the rest of it is covered by trapezius. Distally, it blends into the ligamentum nuchae and C7 in the upper 4 thoracic vertebrae, and it passes upwards and laterally to attach onto the lateral third of the superior nuchal line and adjacent mastoid process. Very short, powerful muscle which produces extension of the head and of the neck. This is assisted by trapezius and obviously by erector spinial, the cervical portion of erector spinae again. Now, there's a handful of small muscles in the posterior aspects of the neck that can often become very overly tight. So these small muscles here, we've got rectus capitis posterior minor, rectus capitis posterior major. So these two are the two rectus muscles. We've then got the superior oblique here. And when these muscles become tight, we can often get patients who have an extension posture of the head on the neck, and tightness in these muscles can often lead to cervical headaches. So as a manual therapist, as a clinician, it's often our role to either stretch or lengthen these muscles, or teach patients how to switch their own suboccipital muscles off. There are 3 muscles at the side of the neck called the scalenes that basically pass from the transverse processes from the anterior and posterior tubercles of the transverse processes of C1 down to about C7. Scalenus anterior, medius and scalenus posterior. They then pass down and attach onto ribs 1 for scalenus anterior and medius, and onto the external surface of rib 2 for scalenus posterior. Now these muscles are important to say because not only do they produce side flexion and rotation of the cervical spine, but they also will produce elevation of the upper 2 ribs. And again, overactivity of these muscles can lead to elevated ribs. One of the problems that we have in those situations is overactivity of these muscles can also lead to the first rib sitting too high, which then means that the vessels that come to the upper limb that pass over the first rib, the subclavian artery and subclavian vein, can become compressed, either by the muscles themselves or by the elevated first rib. These muscles in side flexion are assisted by muscles such as splenius cervicis and the upper fibers of trapezius, sternocleidomastoid, etc. There are some small muscles that play a role in side flexing the head on the neck. Muscles like rectus capitis lateralis. Again, a small muscle doesn't have a great mechanical advantage, so it produces tiny movements, tiny adjustments really of the head, rather than producing great big explosive movements. So here we've got our posterior muscles, we've got trapezius, and underneath that we've got levator scapulae. Over here we've got the scalenes themselves, and here is our rectus capitis lateralis. Muscles which produce rotation of the neck include the semispinalis portion of erector spinae here, that will produce a bit of rotation. Multifidus, these facets of multifidus here will assist with rotation. Scalenus anterior and splenius cervicis will also produce rotation, as does sternocleidomastoid, although sternocleidomastoid tends to rotate the head on the neck rather than the neck itself. That is then assisted by splenius capitis that also has a cranial attachment. They're assisted again by this posterior suboccipital triangle. So we've got over here the inferior oblique and the superior oblique there, and then rectus capitis major. And this is the suboccipital triangle that we often talk about as being overly active. Now, the suboccipital triangle may be fairly small muscles. Their primary function is for stability of the head on the neck. They are very important muscles as they provide fine control of head position. And not only that, these muscles are very richly innervated in proprioceptors to give us a fairly acute awareness of where the head is in space. And so overactivity or tightness of these muscles can lead to fairly significant maladjustments of the head itself.